back into the lymphatic system, affecting the unidirectional valves of the lymph vessels, which then become varicose. Now, he mentioned the varicose lymphatics, and he said that they become engorged and enlarged, and you can actually see them on scans. He did lymphangiograms, but the trouble is that most people who saw it said, well, it's just veins you're showing in scans. It proves that they're lymph. So he could never absolutely 100% prove it, although it is mentioned in the books. A few years ago, I had the luck or the fate that a patient came in where we could actually see it, absolute see it, and he visibly shown it. And this is the subclavian region, this is the clavicle, that's the armpit, and you can see these are very, if we go back to that diagram there, and you see there quite clearly the varicose lymphatics. Now, if you actually enlarge it, you can see it more clearly. And how do we know they're lymphatics? I'll just show you that this is where the collapsed valves are. But how do we know that they're not veins? Normally lymphatics wouldn't be visible at all. They'd be so minute, the diameter, and they wouldn't be visible at all. But this is definitely visible, and we definitely know it's a lymphatic vessel. Does anybody know how we know? Colourless, exactly. If they were blood vessels, if there were veins, they'd have blood in them. They'd be blue, they'd be purplish. These are the same colour because lymph contains a white fluid. In fact, the old name for lymphatic vessels was lacteals. So they used to think it was like a milky white fluid. So it would be the same colour as the skin. And you can see the same on the other side. You can see quite clearly. Now this is very, very rare to actually see it. I was looking for this for years, and we actually found it. But you can feel it in every ME sufferer. The physical finding, as an osteopath, I'm physically examining the patients as well as taking a full case history, and we are looking at the physical signs. We are feeling the body, and when we feel the body, we can feel this in every single one of the patients I've seen with ME. They have these varicose lymphatic, these very, very palpable vessels that are tortuous and bulbous and sort of beaded-like. So the theory is as follows. ME starts by a problem in the head and the spine together. If you just had a problem in the drainage of the head, the spine can still, the jaw lymphatics, the perivascular spaces down the spine can still drain off the large toxins that are coming into the brain from infections or heavy metal poisoning, and Professor Hooper's done a lot of work on different on vaccines and how in Gulf War syndrome, all these terrible toxins entering the brain. Now in a healthy, there's 60,000 toxins that can affect the human body. Every year chemical companies are producing another 1,000. So we're not talking about one or two, we're talking about thousands of toxins that should drain off from the brain and the spinal cord, but aren't. And it's not just the head or the spine, it's both. So what we see in all ME sufferers is problems in the head that we can actually feel and sometimes see, and problems in the spine that we can mostly see. If that happens, then there's going to be a build-up of toxins. All the toxins aren't going to drain away. It's going to start affecting the nervous system, and especially the hypothalamus. From external stimuli to internal stimuli going to hit the hypothalamus via the limbic system, good stress and bad stress. And we heard from Brian about how marriage can be a bit of bad stress sometimes, and but hopefully it's only good stress. But it's still stressful, and via the limbic system it's going to affect the hypothalamus big time. The hormonal system is going to affect the hypothalamus, and these are the two reasons why I feel women get ME much more than men.